morning, good afternoon, or good evening, depending on where you are in the world, and welcome to today's webinar, Advanced Health, that brings you acceleration of digital health post the COVID-19 world. This webinar is part of Omnia Health, which is a global virtual event bringing together all healthcare professionals, and Omni Health is part of Informa International. We have a distinguished list of panelists, or I would say co-panelists here with me today. And I'm very excited to be starting this dialogue with them because they all bring vast experiences and knowledge in the field of digital health. We have with us Dr. Mohammad Al-Redha, who is the director of the Dubai Health Authority Project Management Office and Health Informatics and Smart Health Department. Dr. Mohammad is responsible for setting standards to implement and manage complex health information. We also have a dear friend, Christine Arakelian, who is the founder and CEO of Global Health Integrators, and as an expert in the US, European, and Asian emerging markets in the health systems, health governance, mediation access, technology, and health care big data. She's joining us from the US, and all the way in Australia is Dr. Louise Schaper. She is the CEO and fellow of the Australian Institute of Digital Health, where she brings together world-class researchers, innovators, and organizations from across the biomedical health and technology spectrum to use tech and data to improve healthcare outcomes. This is all what we need, Louise, so we're excited to be talking to you about it.
Right.
And lastly, and last but not least, is Alex Butler, joining us from the UK, is a digital health expert with more than 15 years experience in leading digital health transformation at blue chip companies like Johnson & Johnson, and is the founder of award-winning agencies such as Foundry 3. I'd like to start with Dr. Mohammad, as these couple of last months I think have been very challenging in terms of managing the COVID-19 pandemic here in Dubai and in the UAE. Can you tell us, how did the Dubai Health Authority use data and informatics to manage COVID-19?
Thank you, Marwan, and thank you to the lovely ladies and gentlemen with us on the panel today. And thank you for hosting me to speak at this wonderful digital event. Since the beginning of the pandemic in Dubai and in the UAE, I think it was very evident that we're going to be reliant heavily on data, be it the number of positive cases or the number of negative cases, number of patients that have recovered, number of beds. So it was always on the right numbers to be delivered to the right people to take the right decisions. Systems in place, thankfully, worked together, coordinated together to supply us with the right data, hence the right information, hence the right decision to be taken in a timely manner. As you are all aware, at this stage, the variables were huge at the beginning of the pandemic, and it was very difficult to get hold of the right situation to take the right action. However, the clarity of data, the availability of data even before that, made it possible for us to take decision and to take timely action in order to be able to control the situation. I think the infrastructure that was in place and the infrastructure that was in place played a huge role with us in Dubai Health Authority to be able to move through the stages of the pandemic. And alhamdulillah, we have seen the interplay between these systems. I think everybody would have loved to have a paperless nirvana and an integrated nirvana as well, where everything was coordinated in a seamless fashion, I don't want to say that we have had a lot of integration at the beginning. However, we had some integration. Right now, I think we believe more in integrating these systems in order to get to a coordinated action in a coordinated manner, not only in terms of healthcare, it's also across government. We're a group of 37 government entities in government of Dubai. The more integration with our systems, the better in fighting such a pandemic.
Excellent, very good. Christine, if I move to you and talk a little bit about telemedicine, because today more than ever, and I've seen this adoption, starting with people at the age of my mother-in-law, who was saying she was very happy about getting her prescriptions while talking to the doctor virtually. That is something I never saw, in my life, and the adoption was rather quick. So there are some things that I think that came out very positively out of this pandemic, but many people say that there are limitations when it comes to telemedicine. So how can we overcome those limitations?
So thank you, Marwan, for the question, and again for inviting me to be on the panel. Let me just take just a few steps back and frame this out for people. My company, GHI, recently submitted a submission to the Department of Defense, and specifically the U.S. Department of the Army, dealing with this precise issue. So, and this is public information, the Army is basically going to be standing up across the United States for 320 million people, a virtual ICU, okay? And they were looking for novel solutions and telemedicine capabilities that would allow them to do that, that actually would then extend globally, okay? So we actually submitted information and suggested approaches with our technology platform to the Department of Defense and the Department of Army. And I'm pleased to let people know that we were deemed eligible for funding from the Department of Defense for the next 2 years. So the things I'm talking about are actually sort of validated on multiple levels. Okay, so this is really important because I don't know where your listeners are from, but I'm sure a lot of different countries around the globe, including the United States, are looking at capabilities such as a virtual ICU to augment capabilities at a hospital. And a lot of people in the United States don't live near a hospital with an ICU capability, and that could be the case, and is the case across much of the world. And if there needs to be a surge capacity. So these issues are extremely important in terms of what is it going to take basically to have a robust response to COVID-19 and other capabilities. So let's just talk about telemedicine, because I think a lot of things are run together in healthcare. We use a lot of words, and a lot of times I wonder if people really know with precision what they mean. Okay, telemedicine is really, from my perspective, a capability that exists between a physician and a patient and collecting data. Where it really is lacking in terms of telemedicine is really the ability to have more cohesive patient data sets. Okay, that is actually the major issue in healthcare today. It's not the inability for a physician to basically interact with a patient and gather data. That's a very, candidly, in the grand scheme of things in healthcare, a very low-level capability. Okay, the real issue is actually, again, more cohesive patient data sets, and that in turn requires a consistency and a clarity in how patients are managed, so there's comparability in the data. Now, the issue is that as you look at countries looking to scale telemedicine capabilities, okay, at the beginning, everything seems great, right? You're running a small pilot, basically you scale it to a certain level, and then basically you're saying, look at these great results. I can support James Smith, John Doe, whoever it is, basically at home. But then you hit a ceiling. And the ceiling in telemedicine is effectively that the cost of the technology exceeds the value of the data, okay? And that's actually where people basically are sort of hitting a ceiling as it pertains to telemedicine that can only be overcome effectively by taking 10 steps back and saying, no, from the outset, we need to create comparability and consistency in the data sets. Once you understand that you need to do that, which, by the way, is not as simple as a technology, okay? If it were as simple as a technology, Google actually would be running healthcare globally. Amazon would have overtaken CVS in the United States. That's not the case, okay? So there's barriers in terms of entering the market because of the sophistication that's required to create consistent data sets. Once you have a robust, large, cohesive patient data set, you then have the ability basically to have that of interest to multiple stakeholders. And once you have a system that is of interest to multiple stakeholders in terms of accessing and analyzing that data, then you have the ability to create a robust network of capabilities that are needed on the back end to support the system. So what are some of those things? Cybersecurity, okay? It's actually one of the biggest issues in healthcare today. AI isn't really possible without larger, consistent data sets. So the rate limiting factor on telemedicine is really embedding telemedicine, okay, within a larger framework in which it makes sense. And given that the topic of the panel is really the acceleration of digital health and COVID, one of the things that's very important to understand is that accelerating digital health is not actually as simple as a better technology, okay? It's actually more complex than that, and it's actually around embedding technology in the creation of relevant data sets that are supported from a regulatory, okay, perspective and lending transparency to the patient and patient population. So I'm sorry this is a very long answer to your question, but I think it's important because hopefully your listeners are saying we need a better response to COVID-19, and there's a lot of smart people looking at that in terms of, what are the inflection points we need to reach very quickly to have the capabilities that we need to respond to COVID. And going to Dr. Mohammad's point, in terms of a systems integration approach, this is exactly what we're talking about. When you have a multi-stakeholder system because you have a relevant data set, that is a system of systems capability, not as simple as a straight line capability. And so it's really important that people realize that those larger capabilities need to be built and exist that are capable of doing the things that Dr. Mohammed and others are looking to do.
Right. Thank you, Christine. If I move to you, Dr. Louise, and tell us a little bit about the healthcare industry. What are ways that these industries can sort of integrate to improve the level of service that they're providing?
Thanks for the question, Marwan. And I'd also extend my thanks and appreciation to Omnia Health Live and Synapse Medical Services, who invited me here today as well. So thanks, guys. So how long have we got, Marwan? That's a big question. I will try and be succinct. So there is health is a wicked problem. And if you've shown up to this event today, you already know that, right? So I don't need to go into detail on that. However, the reason it's a wicked problem, we haven't solved it yet, and we're not going to solve it overnight. One of the things, though, that we have learned, and given the topic of this panel today about the acceleration of digital healthcare in COVID-19, that's one thing that the world has seen. And I think that's really exciting, and it shows how much promise there is. I know that there are different levels of digitalisation of healthcare, and the data sets around the world generally, as Christine has pointed out, aren't great. Let's just put it that way. There's a lot of improvements there. However, that one of the things that we also find is that generally healthcare can be we can get given a bit of a bad rap that we're really quite slow to innovate in compared to other industries, business and finance and others. And yet what the globe has shown, not just where I'm from and where you guys are from, but globally we've shown that we've got 4 million people in lockdown, various stages of that happening across the globe. And healthcare, when healthcare is motivated about improving patient care and improving outcomes for patients, so all about quality and safety, we get it done. And we innovate on a dime and we can do it quickly and at a very high quality. And that's something that the COVID-19 pandemic has really shown that we're capable of. In Australia, as an example, when it comes to telemedicine, our government, there was various media conferences for the couple of weeks when this all started, and they just started easing restrictions on telehealth, and then they'd ease them a little bit more. And it didn't take very long before they went, okay, the restrictions are off. We will pay for telehealth, and we actually will encourage you. And it didn't happen very long after that unless, you had a really dire need, if you got in contact with your hospital or primary care physician, you would be told, no, we're going to do a virtual consult first. So we changed very quickly, and there is lots that we need to learn. And that's one of the things that I think this event is really exciting. By bringing together these thousands and thousands of people, we're not solving the problems here in isolation in Melbourne. You're not solving them in isolation in the US or in Dubai. These are problems that are global, and we're all working on them together. I guess one other thing, I'll just make one more point because I'm sure we will jump around as our session goes on. But one of the key things that we haven't done globally very well, which my organisation, it's sort of our strategic imperative, which is around upskilling the workforce in digital health. So for the majority of clinicians, and I know this isn't necessarily everywhere, but it is a global problem, we introduce you when the hospital that you work for or the healthcare service you work for decides to invest in a data system, in an IT system, you get trained in how to use it. But you don't necessarily get trained in why, and that's where the health informatics and that digital health expertise comes in. So we're doing a lot of work, and there's huge momentum in this now globally that I'm seeing, at least in our pocket of the world and in Australia, to look at, okay, how do we upskill people across the sector of healthcare in digital health? And that's for people like myself and Alex and others who are specialists in informatics, but that's not everybody, right? We need more specialists, and if you listening today want to be one of them, please, we need more of you. But for the majority, you're just really busy being a physiotherapist or a gastroenterologist or a nurse. So, but it's 2020. What is it that you need to know about digital health to upskill and to be the very best clinician that you can be using digital health? So that's one of the things too, I think, is happening right now.
Yeah, we absolutely need everyone to be on board. It is not just, a gastro doctor being gastro doctor and then leaving the digital health to someone else. No, it needs to be fully adopted, fully embraced, and really, they need to be part of the equation. Alex, if I move to you and ask you about the developments in digital health adoption during the COVID-19, do you think it's been done in a sustainable way and in a way that does not uphold any best practices?
Yeah, thank you. And I'd just like myself to say thank you very much for inviting me onto the panel. It's great to be amongst such an esteemed company. And my perspective is probably slightly different because most of my time is spent supporting pharmaceutical companies and actually on the other end, supporting small startup companies in digital health. And sustainability, that's a really interesting one. I think I'd split it into 3 different sections with regard to COVID. I'd split it into technology that's being used and developed to literally manage the pandemic, and technology that's being used I suppose, to try and manage the fallout from the pandemic with regard to other aspects of the healthcare system, i.e. keeping other consultations going, keeping management of people who are chronically unwell, who can't access services in the same way. And then I suppose I'd look at it from this perspective of technology that's being developed because of COVID, but to manage other things, so the ongoing management of chronic disease, for instance, in neuroscience, or management of people with cardiovascular disease. And I've seen quite a lot of this change over the time. So in the UK, for instance, there's been quite a relaxation of privacy law with regard to how data is managed. There's been people thinking that they've been dramatically transforming their digital practice just simply by doing video consultations or using Zoom, whereas not changing any other aspect of how they manage data or how they collect data. And so I suppose with regard to sustainability, my concern is that, that at the end of this, there might be some great level of increased enthusiasm for how we could use digital technology to improve outcomes for patients, but that it might revert back to the mean quite quickly if we're not careful. Because I wonder if the massive focus on COVID-19 and its management in some way is masking the fact that for a long time, in my personal opinion, we've not done what we could to help people. So if you, for instance, are a cancer patient in the UK, it's ridiculous that, every few months or even sometimes every month or sometimes every 2 weeks, you have to travel from where you live to go into hospital to receive treatment, to report on your side effects, to have your toxicities managed, to have your mental health and your quality of life managed. It's crazy, but at the end of the day, that's what happens. Now, at the moment, the scary thing for me is that, yes, it's brilliant that people have coalesced around, fighting COVID-19, but we have a situation where people going into their primary care physician because they're worried about something that could be possibly a symptom of cancer, or people who maybe have had a mild stroke, or people who have other concerns are not accessing services. So rather than during this period, we've seen digital health expanded to help more people, we've actually seen it reduce and actually, well, obviously I'm generalizing, but, so my big thing and my passion is how can we make sure that this technology is adopted after this is all hopefully passed and we have some kind of normality? Because my father, for instance, who has a heart condition and also a renal condition, he's in his 70s, but he's very capable of doing an ECG at home. He does his own blood pressure, he monitors his blood oxygen levels, he's very capable of having a video consultation with his consultant. Yet before, he would have been classed as an older generation who wouldn't be interested in using digital health. And I think we just need to move beyond a lot of the kind of stereotyping that we've done and the excuses that we've made for not introducing these technologies. So hopefully that's not too impassioned. But that's
agree completely.
Can I just jump in there, Alex? Like, your point was brilliant, and honestly, it really needs to be said. Trillions of dollars across the globe are being deployed now to respond to COVID, and it really begs the question of whether all the technologies, can be utilized simply for COVID, because we have a lot at stake across the globe, in answering that question correctly, There's been discussion in the media, and this really threw me for a loop. McKinsey, when the pandemic first came out, said basically this was a shock. This was a shock to the system, and no one could foresee it. I don't agree with that. Actually, this was completely foreseeable in every conceivable way. And
it's not the first time
we
that
recognize that. Pardon?
It's not the first time that we're having a pandemic. We've had very similar pandemics before.
Correct. And in fact, you look back at the record at the number of people talking about data silos in healthcare. It's not so much people are not using technology. It's are we using technology to build the whole, or are we building data silos? Right? Data silos have been the issue in healthcare for some period of time. And so it was actually completely predictable. And what the pandemic is exposing are really the structural inadequacies, at a local, regional, national, international level in terms of how we have approached healthcare data and healthcare data sharing. Right. One of the things, Marwan, that you raised in some of the talking points you circulated before the call relate to privacy. And I actually think that that's an incredibly important point. And even Alex, you touched on it when you said, well, some of the privacy regulations are sort of being relaxed.
Do you mind if we come back to that? Because I think
absolutely.
It's a very big point, and it's important that we address it completely.
Yeah. But wrapping up, Alex, on your point, we really should work together as a global community to ensure the investments on COVID have longevity and address the structural components in healthcare, which have sort of been a little bit off to the side.
Excellent, thank you. Dr. Mohammad, I'd like to go back to the Dubai Health Authority strategy. Do you think that what happened with the COVID-19 scenario, did it want you to relook at your strategy, or it is more or less in line with what you're doing and the strategy that you have for Dubai?
So our existing strategy takes us up to 2021. It started in 2016. Program 13 out of Strategy 2021 depicts specifically more than a system that were able to be part of the infrastructure of fighting the pandemic. Starting from our electronic medical record to our, which is by the way called Salama. We are also reliant heavily on a system called Hasana, which is a communicable disease reporting system, and multiple other systems. Even, and you'd be amazed, even our licensing system, Sharian, was able to help us fight this pandemic. I think at that stage, when you are at the forefront, you would use whatever you have, however, in an integrated manner. I think our strategy served us well. However, our next strategy, hopefully the one that we're going to build after 2021, would take into account the occurrence of a pandemic, and literally the occurrence of a pandemic. I think the scientists around us are speculating that there might be a second wave or maybe a different pandemic. How soon or how far, we don't know. However, we have to be ready. And I would like to quote His Highness Sheikh Mohammed bin Rashid Al Maktoum, the Vice President of UAE and Prime Minister and ruler of Dubai. He clearly mentioned in one of his tweets that you are mistaken if you think that life after COVID-19 is similar to life before it. So that will be applicable to all of the strategies in the United Arab Emirates, federal government and local government. And I think we're going to be seeing that fighting a pandemic or being ready for one. And I don't want to be very pessimistic here. However, we have to be ready for so many other things that are on a similar scale to a pandemic.
Mm-hmm. Other than listening to scientists a little bit more, what other lessons would you keep in mind putting together next year's strategy? I think
digitalization has been at the essence of our previous strategy. However, what is next? We have always been taught as informaticians that you gather data, you make information out of it, and you create advice. I think if we would take into consideration the advice bit, since a lot of the building blocks around us have been laid, a lot of the infrastructure is there. So how do we engineer more advisory tools at the fingertips of the doctors, the decision makers, all healthcare professionals, and as well as everybody who would be at the front line? What sort of data would they require at their fingertips to be agile enough to respond? And I'm using two hats interchangeably here, the informatics hat and the project management hat, where today we are taught that we have to be nimble, we have to be dynamic, we have to be able to react. And I have seen, so many departments in government of Dubai, senior directors respond wonderfully. And these are directors who are at the level of my professors in pharmacy and microbiology and pathology. However, seeing them react in such a way that they were almost, in the shape of a gazelle reacting to a lion, was impressive, really. The speed was of essence. The way they reacted to changing their plans. Mind you, they all have their conveyor belts ready. They all have their regular operations ready. To change that, to keep that and add them to the conveyor belt or create more conveyor belts where they are fighting a pandemic. And alhamdulillah, they were able to be agile, dynamic enough thanks to the systems that were there, and thanks to the leadership that was supporting everybody on the ground. I think that gave us very good psychological support, even though we knew resources were maybe late to arrive, be it from PPEs or even human resources to be arriving on the ground, or even building hospitals or extra testing facilities. I mean, yes, we know it takes time. However, still, with their inavailability at the time, we were able to react. And then when they became available, we were able to react in an exponential way. Again, I would like to stress the systems behind it, whether it's financial systems, human resources systems, data analysis, data gathering systems. And as I said at the beginning of the conversation, I would have liked to see more and more integration. With that not present, we were able to integrate it at least in a psychological way, in an algorithmic, and if I may use the word, human algorithmic way rather than artificial intelligence way, was impressive to see on the ground.
Excellent. Thank you very much. Definitely lots of lessons learned from what happened in the last few months. Christine, if I move to you, and let's talk a little bit about big data analytics. What does it really mean to a layman? I mean, how can we, is there anything that is, limiting us to have this few sort of hands-on analytics? Because it could be very powerful in terms of predicting the future, predicting the cost, predicting what sort of models should be in place. But what sort of, tell us a little bit about, the big data analytics part and what could be limiting factors.
Sure, and thank you again, Marwan, for the question. Big data is only as good as the data that is entering and being analyzed. Okay, and this is going a little bit back to the points that I made earlier on the limitations of telemedicine. Okay, insofar as we are not creating higher level data sets with consistency and transparency and predictability, basically that data set is of limited interest to other stakeholders. Okay, if other stakeholders are not using the underlying systems from a systems integration approach, going to the point that Dr. Mohammad is emphasizing continually, which I think is correct. Okay, it limits the ability to do higher end analytics. Okay, the point of big data is actually not to get at the data you have or the data you know. It's actually to get at the data you don't know. Okay, meaning the more prescriptive, the more understandable a data set is, okay, and more limited in terms of its data silo components, the less capable you are of doing big data. Okay, and so the rate limiting factor is really, again, the creation of data sets that are of interest to multiple participants, because that in fact is what yields the larger analytic capabilities and interest for a broad group of people. So I think, and then the question begs the question of, well, what's going to allow for that? And that's where you really start looking at regulatory and other sort of healthcare structuring and training and SOPs, and embedding technology into a larger framework that allows for those cohesive data sets to come into play. So candidly, I think that is the biggest obstacle to big data today. And again, I'm not sure when we'll turn to security, but just very quickly, the perception of security does not correspond necessarily to actually being secure. So for example, if you're driving a car, a lot of times you feel safe, but if you actually look at the accident rate, it's quite high because there's an element of unpredictability. The same thing with small planes, right? I like using simple examples. you might have a sense of control, but actually, if you fly in a very small plane, say for like 1-2 people, the ability to have safety mechanisms built in to the back end is extraordinarily limited. Now, if you fly in a Boeing 777, you have a lack of a sense of control, okay? Because you might be in the back, but actually that's a much safer thing, even though your perception of control and knowing what's going on is less, okay? Big data analytics will require a cybersecurity infrastructure that allows people to feel safe in doing the type of analyses they need to do, while at the same time having security on the back end. And that in turn requires a much more scalable, right, robust, multi-stakeholder infrastructure. So hopefully those touches on some of the points, but I think we need to start reaching consensus, just like Alex and Louise and Dr. Mohammad have alluded to earlier in terms of the multilateral response to the pandemic. We need to start reaching consensus points on what some of these things look like and how they can be implemented very quickly.
Mm-hmm. All right, thank you. I know we touched upon privacy a little bit, and I think one of the things that I always discuss among industry players, doctors, patients, is that are we giving out our privacy for convenience? And is it like the currency of today? So I will give out my privacy, my private information for convenience. And it seems to be the case, because if you look at the airports, for example, those who are allowing entrance through the retina. So I'm giving that information to the airport management. However, for that, I'm getting a very seamless entry into that airport. Is it the same with healthcare? Are we giving up our information for convenience? I'd like Dr. Louise, if you could start, and then maybe we'll hear from the rest as well.
All right, Marwan. Thank you. That's a really good point. And yeah, it comes up a lot. And look, I think I'm fascinated to hear what everyone else has to say on this one. So I'll keep my answer brief, because I do think it's very cultural. So generally across life, yes, we give up. That's not even up for debate, is it? That's why the people who are worried about 5G and being spied on, it's like, are you kidding me? That thing you carry around all the time in your pocket, you're already carrying a tracking device around. And we all know that, and we don't care well or not enough to not do it, right? So, but when it comes to healthcare, at least I can speak from the Australian experience, it is very, very different. So as an example, Australia has what we call is the My Health Record. So it is because healthcare is basically government funded. I mean, it's private as well in Australia, but a large piece is government funded. And so years ago, they put together the infrastructure to create the My Health Record, which is meant to be a secure online a record of my healthcare, and I control who has access to it. So I can say which clinicians and which hospitals and all that sort of stuff. Generally, there's only, I think only 10% of Australians opted out, so they're in. But before they churned it around to that, you had to, when it first launched, you had to opt in and put your hand up and say, oh, I want to be part of that. And hardly anybody did. And then when the legislation changed and they said, okay, well, look, everyone's getting one. And if you don't want one, then here's all the things you need to do to opt out. And they made it pretty easy to opt out. And yeah, not many, less than 10% of Australians opted out. However, I can tell you that's been running for quite a few years now. And I did it last week when I was teaching a class. I logged into my record to see what was in there, and there's not a lot in there for most people. So we still have challenges in terms of people, not just us as consumers, as patients, for willing to share our healthcare information. People are very concerned about security and their information falling into like the hands of insurance companies or others. But we also have a cultural issue with clinicians. So clinicians also, and hence my earlier point about upskilling the workforce and increasing everyone's literacy around digital health, is the reason there's not much in my record, for instance, is because the clinicians that I have seen this year, even though I begged them to, I haven't been very persuasive, and they don't need to do it, so they don't. So if I go in there, I see a record of what drugs have been administered or prescribed to me as a result of, because government pays for them. So there's that record, but that's it. So it is a complex issue and one that we do need to overcome.
Christina, I see you smiling, so I'm sure you have something to say.
I was going to say, I think we should give Alex a chance, but I'm happy to speak on this. So look, I think everyone has the right to basically be concerned about privacy. Okay, it's a bedrock principle of everything in healthcare. It is a foundational trust that people need to have in the system. Okay, having said that, I think sometimes privacy needs to be framed out a little bit differently. And for me, it begs the question of whether we actually have privacy right now. And I think the answer to that is no, because the number of data breaches in healthcare is actually staggering. They're not reported, okay? Just to give you an example, and this was publicly reported in the media, so I'm not disclosing anything that is confidential when it's already reported in the press. HHS's systems were compromised, okay? These fissures we have from data silos and lack of interoperability across countries is actually leading to breaches in privacy. Okay, so again, it's a perception issue of where do you feel secure? And I think one of the things that we really need to do a better job on in explaining to the public is, so look, we've all enjoyed the many of us have enjoyed the benefits of globalization, okay? But part of that globalization actually needs to be information sharing so that governments can protect us, okay? And basically that information is used appropriately so that there's effectively an audit trail. For what purpose is that information being used? So, for example, in the United States, there is talk and an initiative to integrate travel data from U.S. Customs into HHS networks so that when someone travels and then goes to Minnesota or goes to Iowa or goes to Maine, right? So ordinarily, that's a lot of information on one person, but do we need that so that we can basically, travel and enjoy and engage in a lot of the things that we have? So, and I think the answer to that is yes, a lot of people would be willing to make that trade-off. So I think if we can do a better job explaining the current security risk that we have, okay, as well as sort of what is the purpose for which this data is being used, that would go a long way to addressing, the concerns that people have. One of the things I also point out to people is actually the most ubiquitous telemedicine tool today is WhatsApp. It's actually utilized to transfer healthcare records all over the globe and query whether your healthcare records transferred on WhatsApp are actually secure and not mined for data. And that's what I mean by global scalable technologies where there is crystal clarity on how the data is being used. I think it's far better that we make the investment and explain to people, really educate people on privacy and why we're using the data. My hope is, Marwan, is that over the next 10 to 20 years, that just like an airplane flies over multiple countries, and nobody says that, you know, if I see an airplane above my yard, I don't say my privacy has been breached. And somehow we need to reach an equilibrium where in healthcare, people feel the same way. If someone next door to United Arab Emirates came back from a travel location and has been exposed to a deadly pathogen and could spread it, United Arab Emirates needs to know. And I'm hoping that we can get to that point.
Excellent. Thank you very much, Christine, for that. Alex, what's your perspective of privacy in healthcare?
So firstly, I think I'd like to say that I'm much more interested in small data than big data. And the reason I start with data is because that's what we're talking about keeping private. And actually, the reason I say that is because I think digital health, at its best, has the capacity to rebuild healthcare with the patient at the actual heart of it, rather than organizations or governments or whatever it might be. It's a bit idealistic, but I still believe at its best it can do that. At the moment, we have the capacity to track data, for instance, walking data, cognitive data, capacity to draw shapes, to essentially predict possible relapse in multiple sclerosis. Very few people with MS use that technology. And we have the capacity through wearable technology combined with smartphone technology to predict severe epilepsy seizures. And very few people use that. The truth is that it's not about convenience. It's that if people are given the opportunity and given the capacity to track and measure and monitor their own health so that they can have a genuine impact on improving their life, then I think that they will use it. And then the question is, how do we make sure that that data is used appropriately? And we all know how that we use it appropriately, which is that people know exactly what it's going to be used for, they know how it's going to be stored, they know that it's not going to be shared with people that they want it shared with, and they know that they have access to it. Going back to when I first started in the pharma industry, which is unfortunately quite a few years ago, if you walked into a hospital, you'd see people's notes on a hospital trolleys. Notes would fall off, people's notes would get lost. If you went into your primary care GP's office and said, can I see my notes? The answer would be no, that's not yours. And so, you know, the idea that we've come from a kind of amazing position of privacy for our healthcare data into a position where we're in danger is, in my perspective, ridiculous. For example, in the US, there was a period where people in the early days of HIV would have HIV in red letters written on the front of their notes. You know, I don't think that's respecting people's privacy. So I suppose, you know, from the perspective of, is it something we should be concerned about? Absolutely, yes. And if, however, you're a patient managing a serious disease and you have the capacity to improve your life by using technology, then that should come first, and then we should do the right ethical things and have the right things in place to make sure that data is managed as well as possible. But, you know, this is, you know, we're human beings, and mistakes will be made, breaches will be made. We just need to do the very best we can to manage it. But I think we have to start from the perspective of how can we actually improve people's lives through this technology, rather from the perspective of how do we manage data, because I think that that's just coming at it from completely the wrong direction, in my opinion.
Excellent. Thank you very much. Dr. Mohammad, back to you, and sort of this is, let's say, maybe the closing question for you is, what would be, you know, the lessons from the COVID-19 experience? And obviously we're still living it. What are the things that will sort of has, you know, taught the DHA moving forward? And you know, what would you also advise people who are in the sector as well?
Marwan, I'd like to comment on your previous statement where you said sharing data for the convenience. I think it's for the convenience of being alive. So we have a term, and you know, when we're installing systems, electronic systems, and so on, you have a concept called break the glass concept, and that's where you go break the glass and dive into whatever data you need to save a patient's life. I think it's been applicable to many parts of the world that have been trying to save as many people as possible from the current pandemic. However, moving forward, and your question about the best lessons learned from COVID-19, I think we as human beings have been very focused on the past 5, 10, 20 years of development. However, when I look at the Spanish flu pandemic, which happened in 1918, exactly 100 years ago, and I look at previous pandemics, which happened as early as the first 100 years AD. I think there are so many lessons to be learned, specifically on pandemics in the past 2,000 years, if not even before that. We have been so bogged down on the past 20 years of our modern lives, where history books have been writing all of the pandemics that have happened, documenting it well. Not even history. I mean, YouTube. I always tell my children, if I had YouTube at the time that I went to med school, I would have finished med school in 4 years instead of 7 years. So YouTube documents all of these pandemics so well. You've got a narrative and you've got a video with it. You've got music, background music as well. So it's as entertaining as can be and as educational as it can be. Yet we have been so bogged down on the nitty-gritty of details of the modern era and forgotten all the wonderful lessons that history can teach us. I myself learned a lot from the Spanish flu. The Spanish flu lasted 3 years. Hopefully, this pandemic will not last 3 years. We have better, bigger tools, more resources than what they had in the Spanish flu pandemic. I did a little bit of research about what tools they had during 1918. And as you can imagine, communication was via newspaper. Wireless and radio wasn't even invented at that stage. Maybe it was with the army or military, but it wasn't widely used. So it was newspaper that was widely spread. And by the way, it was called Spanish flu because the Spanish newspapers were able to document everything that happened. And whoever read about it read it through Spanish newspapers because they were continuing printing and they were not at war at the time. So I think with the resources that we have around us right now, we should be able to fight such a pandemic faster and more efficient. I wouldn't use the Spanish flu as a direct comparison to what's happening right now. It's definitely not apple to apple. However, there are so many other recent pandemics that happened on a smaller scale. Luckily, the SARS and MERS also, I think there are good lessons to be learned there.
Excellent.
I think also on a non-clinical scale, the studying from home infrastructure that happened for our children, I think has to be better expanded, better utilized, distance learning. Working from home, definitely, with government of Dubai instructions, having 100% of their staff at the liberty of working from home, I think needs to be even further expanded and policized. We have utilized it very well during this pandemic. However, there are so many lessons to be learned from those two domains.
Thank you. Dr. Louise, what are your thoughts on lessons learned from COVID-19?
Thanks. Excellent closing question. I will refresh my first point that I made about just we've known about it for a long time, but now we've shown it at a global level, how you motivate clinicians and how you motivate the healthcare sector. And it's all about improving patient care and improving consumer outcomes. So if we look at quality and safety of care, we'll do whatever it takes because we're always going to put patients first. And I noticed Alex, saying a similar thing, this digital health has a lot of promise to do that. And we've seen it very at a global scale. The other thing that we've learned is what consumers or patients, depending on what you call them in your part of the globe, people who are listening to this, consumers now know this is an option. So the majority had no idea. The majority, we've discussed it already in this session, thought that, oh, okay, I have to go to a waiting room and I have to line up for ages to see a clinician, and I have to wait months to get in. And in Australia, where we have this massive geography, you know, if you're in a remote cattle station, it can take you 3 days for a 20-minute doctor appointment that you can, and now, because no one was offering it to you before, so now consumers know. So that's what I'm also hoping is that, and we will see this globally, that it will become politically unpopular to wind back those restrictions and go back to the way it was before, and telehealth isn't as a widespread option. So I think we've learned that, which is all about making the promise of digital health just so much more real and so much more tangible. There's a lot we need to analyse of what's happened in the last few months, and hopefully, as Mohammad said, not the next 2.5 years. But, you know, there's a lot of work that we need to do in really looking at what we have learned. And we've also know that this is very much global. You know, no, I don't know many people except for the epidemiologists that used to, pre-pandemic, pay so much attention to global health issues, unless you were, you know, a global health expert. The rest of us were blindly just, you know, living in our own little bubble of what we were working on. And so now we've seen just how connected we are in regards to healthcare as well. So again, if we can harness that momentum and that energy, imagine what we can do together. So I'm looking forward to it. Oh, Marwan, you're on mute. I'm just going to say, you said brilliant point, Louise. Good one.
Thank you. Thank you, Louise. Alex, what is your perspective on in terms of lessons learned?
Well, in an attempt to not repeat what has already been said very well, I think my hope is actually that, a little bit in the vein of what's been spoken about with people realising that things exist, my hope is that the fact that doctors are being now reimbursed to see people through telehealth, or that systems have been changed to capture data of patients on clinical trials remotely or being managed with chronic disease. I hope these things now, rather than just being a crisis thing to cope with COVID, I hope it's now unacceptable going forward for people to have to do the things that people have said. Why shouldn't we be able to monitor our health and for it to be reimbursed by healthcare professionals to use this technology? So my hope is that at the moment we have a situation which is scary, which is people are not coming forward with other health conditions. But in the future, let's hope that this can actually be a catalyst for this technology being used to manage all diseases better than they were being managed before.
Absolutely, absolutely. Christine?
Great points made by everyone. It's kind of hard to outdo all of you. What I would say is this. We've talked about big data. We've talked about small data. Let's talk about actionable data, because whether it's big or whether it's small, it needs to be actionable, and you kind of need both. As I advised the Department of Defense in our submission, basically putting a COVID patient in Iowa in the context of COVID patients in 49 other states yields real benefits, and talking about workforce training and things of this sort, which candidly, that almost deserves its own session. It's so critical and it's so important. The utilization of technology is going to be facilitated through actionable data. And the last term I sort of want to throw in there, given that we're sort of towards the end here, is the democratization of data. Okay, that is crucial to ensure that data is available at the right time, at the right place, for the right purpose, with transparency and auditability. And I think we can get there, guys. We can definitely do this. And going to Louise's point, what incredible momentum there is to come together in countries and across the world to really precipitate and make these things happen. It's a great time to be in healthcare, notwithstanding the difficult circumstances we're in. And it's really an honor to be on this panel with you and to be addressing these issues with you today.
Thank you, Christine. Thank you, Dr. Louise, Alex, Dr. Mohammad, for your participation and really your thoughts on this topic. It's a very big topic, and we could be sitting here, you know, talking about it for hours. But I think this was important for us to discuss this on the Omnia Health platform for others also to participate and also to learn from the lessons that we have been through. I think digital health is really the way for the future, and there are various ways of people being part of it, and it is something that will shape the future of healthcare. With this, I'd like to thank you again for your participation, and have a lovely day. Thank you very much.
Thank you,
Thanks for
Marwan.
having
Thank
us.
you, everyone.
Bye,
Thanks.
everyone.